Welcome to the Couva District Health Facility Emergency Department, where our team of specially trained healthcare professionals are here to serve you during your time with us. Here are a few guidelines to help you better understand what happens in the emergency department. The Southwest Regional Health Authority, SWRHA, provides healthcare for an estimated population of 600,000 persons at its healthcare facilities. At the Couva District Health Facility or the Couva District Health Facility Emergency Department, we serve approximately 180 patients daily. Our emergency department follows the operation of a triage system, the Canadian Triage and Acuity Scale or CTES rating. When you come to the emergency department, your triage level, it will be assessed at the triage station to determine the severity of your medical condition. This screening process is a method that systematically prioritizes cases based not on who arrives first, but rather whose condition is most critical. It enables the emergency department to prioritize patient care requirements, triage patients according to the type and severity of their presenting signs and symptoms, and ensure that the sickest patients are seen first when the emergency department capacity has exceeded due to visit rates or reduced access to other services. The 5 CTES level includes Level 1, resuscitation. The patient's health condition is deemed to be a threat to life or limb or in a state of deterioration, for example, heart attacks, life and death situations. Level 2, emergent. The patient is in an unstable condition and requires early intervention before imminent deterioration, such as a client brought in from a vehicular accident or with head injuries or unconscious. This patient needs to be taken immediately to the resuscitation room. Level 3, urgent. These are conditions that could potentially progress to serious problems requiring emergency intervention. These may be associated with significant discomfort or affect the ability to function at work or daily activities. Level 4, less urgent. These patients are usually the one with injuries to limb, headaches, fever, back pains, etc. Level 5, non-urgent. This emergency department is not geared to treat common ailments like bruises, coughs, colds, and headache. Level 4 and 5 complaints can be assessed and treated at your nearest health center. Now that you understand the levels of the triage system, here's what you do as you enter the Couva District Health Facility. As a patient, there are 3 access routes to the triage station. First, if you arrive by ambulance, you'll be taken from the ambulance bay to the treatment area. There, dependent on your condition, you will either be triaged or be taken in a wheelchair to the triage station. Second, if you enter through the emergency department entrance, here, the security officer or the customer relations officer will direct you to turn left, walk down the corridor, then turn left and exit the rotunda. The triage station is the first room on your left. Third, you may enter through the facility's main entrance, where you will proceed down the corridor to the triage station, the last room on your right. When you arrive at the triage station, you will be required to wait in a waiting area for your turn to be triaged. For those walking in, the triage nurse will do a critical assessment and determine the seriousness of your condition. If you are deemed a level 1 or level 2, you will be immediately moved to the treatment area. In the treatment area, the triage and registration process will be done simultaneously at the bed while life-saving treatment commences. All other patients, that is, those whose lives are not in imminent danger, should be seated in the emergency department's waiting area, close to the main entrance to await the triage procedure. At the triage desk, your vital signs are assessed, health information recorded, and your triage level is determined. Based on your condition, you may be required to undergo several initial tests. These may include ECG, pregnancy tests, blood tests, and sometimes X-rays. At triage, please remove your jewelry, especially if you have an injured limb. Rings in particular should be removed as soon as possible. The triage nurse would then put you in a sling or splint if necessary, for comfort, or advise you on what you should do until you are seen by a doctor. Patients triaged as level 3, 4, or 5 can wait in the rotunda area to be registered. If you are a first-time attendee at the emergency department for the calendar year, your basic personal and demographic information is entered on the SWRHA emergency record at the registration desk. A home card with the emergency department patient registration number will then be issued. This card will be valid for 1 year. This process is carried out by the health record staff. If you have been to the emergency department for this year and already possess an emergency department home card with your unique record number, this will assist you in locating your record for registration. In fact, you should always bring your home card, as this will allow you a more efficient registration process. Any question you may have concerning the length of your stay in the emergency department can be directed to the customer relations officers. They can be identified by their identification badges and blue waistcoat with the organization's logo on it. Finally, you will notice the emergency department staff works continuously to serve you. We would appreciate it if you obey the department's rules. 1. Do not use your cell phone in the assessment or treatment areas. 2. No weapons are allowed in the department. 3. Respect other patients' privacy. 4. Respect the members of staff at all levels working in the emergency department, as they try their best to provide an important service to the sick and suffering. At the Couva District Health Facility Emergency Department, we work towards ensuring that the customer experience is worthwhile. And with your support and cooperation, this can be a reality.